Good morning. Welcome to the Pulse of Healthcare. Today we're our episode number 17. I'm here with Peter.
Good morning. I'm happy to be here, and I'd like to introduce Dr. John McCormick, who's an award-winning speaker, communicator, and a published author with extensive experience across a range of subject areas. As a highly decorated retired senior master sergeant from the Air Force, Dr. McCormick led organizations around the globe, earning recognition for his leadership, innovations, and organizational skills. The organizations he led earned distinctions as Best in the Air Force and Best in the Department of Defense, along with other numerous awards. He's taken that skill over to Ovation Health, and today is actually talking about authorizations, pre-authorizations. Dr. John?
Wow, prior authorizations is such a hot topic. You know, it kind of circles around and we hear about it every year. Is it good? Is it bad? Is it really the devil that makes up? Does it increase cost? Does it reduce cost? So what is it? Let's kind of dive into that. Maybe we can. It's a deep subject. I don't know that we'll be able to get down into the genesis of it to determine how because of its complexity. But why do we have them to begin with? So the argument is that the reason we have prior authorizations is because, we're going to peel back the onion because we have networks. And the reason we have networks is because the industry, when they were setting up HMOs and PPOs, and we talked about those in previous deals, were trying to define narrow networks of physicians and facilities that were preferred for different plan types. And the prior authorization component of that, part of that was to keep people that were in those plans from leaking outside of those plans and causing additional expenses. Why? Well, because within that network, there were contracts, and the contracts were known, and everybody knew what was getting paid, and then therefore you could manage the financial budget, which is the fiduciary responsibility of the plan. People don't talk about that a lot. They talk about, we got to get coverage, and that's absolutely true. But there's also a financial component that plans have to be good fiduciaries, of the plan, not for the plan's sake, for the member's sake. All right, we want to provide fair, appropriate service to our members. And we've talked about this in so many other episodes where depending on the plan, depends on the price you pay for a good or service, even if you're getting that good or service at the same facility. Well, that's silly. Why is that? Why are we doing something like that? So here we back to prior authorizations. Well, do we have prior authorizations for Medicaid and Medicare? No. Why? Well, the reason you don't have those is because those contracts are known. The doctor either takes that service or they don't take that service. If they don't take it, you can't go see them. All right? If they do take it, the government has already set the rate, no variation. So I don't need to worry about the fiduciary component for a Medicaid or a straight Medicare member because they can only go to those doctors that accept those plans, and those doctors already have a contract in place that's universal across the United States. Is there some variance in pay? Absolutely. All right. Even not from state to state and even from county to county. But the physicians in those counties know what that rate is, and they elect to accept that plan or not. Now, if that was the basis for reimbursement for doctors and facilities across the country, if everybody said, we'll take 100% of Medicare or 110% of Medicare or what have you, then we wouldn't have a need for prior authorizations. Because then no matter where the person went, the plan would know what the expected liability would be. Right. All right? So we end up in this kind of push-pull. The doctors and the facilities hate to get prior authorizations because it takes up time, energy, resources, and then they say, well, this drives up our costs because we have a higher administrative burden. I agree, you do, right? From the plan side, we go, gosh, it'd be great if just everybody would accept our rates and we'll publish them and you just say, yes, I'm going to take them and we'll just pay you. Then we wouldn't have to have a prior authorization, right? Then the only conflict would be is everybody acting ethically all the time. Well, we know that's not true. As much as I love doctors, happen to be one of them. and we've been working with doctors for since the 1970s in this business. And, unfortunately, as like every profession in the world, doctors and hospitals, most of them are phenomenal. But you got a few bad apples that are doing the wrong thing, and unfortunately, that drives some need for some control mechanisms. So even if we were to get to that nirvana world where everybody charged the same thing, no matter what you needed, no matter where you went, which would help eliminate 90% of the prior authorizations required, we would still need to be able to see who the members are going to and make sure that they're going to a highly qualified physician that unfortunately hasn't done anything wrong. So that's part of credentialing, and we'll talk about physician credentialing in another deal, but we actually go and review all of the physician records to make sure that that physician is operating within the standards set by the American Medical Association, their state board, make sure all their certifications are up to date. Basically they've received all the training that they're supposed to have, because the last thing we want is somebody performing a surgery on you or prescribing you medications or doing something that has not been fully qualified, by their approving board. So let's take that back to prior authorizations. Why are they important? Well, we just happen to have a great example come up this week here in Ovation Health. We had a member had a cardiac event, self-admitted through the emergency room. Went and saw the cardiologist that was there in the emergency room, provided her great care, blah, 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 said, hey, you're going to need a cardiac surgery, and then they, inside of their little club, decided, well, you need to go see this surgeon and do it at that hospital, at this hospital that we recommend. Okay, so remember my previous point. If everybody changed the same, we would have been, oh, that's great, right?
Right.
We don't know the surgeon she was getting referred to, and we didn't have an agreement with the hospital that they wanted to refer to. These aren't long-time providers for this member. They haven't been caring for her for the last 10 or 20 years. These are people she saw in the emergency room, right?
Right.
So when we went and looked for this and said, okay, well, can we make an agreement with these people? How much would it cost? $130,000. Whoa, 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 whoa. A Medicare rate on that's like $30,000, right? So then we go, well, we obviously been in the business a long time. We've got a lot of great relationships with some top cardiologists here in the city. We've got some great agreements with some of the premier hospitals in the city. 2 phone calls later, we've got a great surgeon lined up for this member. We got a hospital lined up for this member, $35,000. And that's why you have prior authorizations. Because as the fiduciary for the member and the plan, if you just wander out into the system, right, because the rates vary so broadly from physician to physician, from facility to facility, right, you have to have some of those control mechanisms in place so you are protecting the member and the employer. Remember, most of the plans out there for larger groups are self-funded. So as Ovation Health and as the third-party administrator for those, it's our job to make sure that you're getting high-quality care and at the same time not overpaying for it. Always back to that car analogy, right?
Yeah.
If we all went to the dealership together and we all bought a car at the same time, which was the same car, we would all expect to pay the same price. In the healthcare world, the price you pay has to do with the plan you have, the TPA you have, and what parking lot you picked the car up on. We think that's wrong. All right. So we would love to get rid of prior authorizations. I would love to see them go away tomorrow. But it's a much more nuanced kind of challenge than just to say, we hate them, they're bad. We do hate them. They are bad. We would love we would love as a plan to be able to extract ourselves in almost every case between that doctor and member relationship. Remember, we are a physician founded organization. We don't want to put the plan, quote unquote, between the member's care and the doctor. We think the doctor's the best decision maker for the plan. Unfortunately, like everybody else in the world, the doctor only knows what they know. And so just like, they have their circle of doctors that they generally do business with, and they have their circle of facilities where those doctors do services. That doesn't make those doctors the best in the business, and it doesn't make those facilities the most cost effective, advantageous, nor does it mean they have the best outcomes. Sometimes the most biggest, beautifulest facility that's out there that you see signs everywhere, it's like, oh, come here, we're wonderful. If you peel that back and look at their actual medical outcomes, it's a scary story. You're like, oh, wow, they had lots of people that didn't make it out of the operating room. And then you just go 2 miles down the road to a facility that might not have all that cool advertising. It may not even be as pretty on the outside, but their outcomes are phenomenal, off the chart, excellent, best in class. You're like, so part of the role of plan, educating the members. Prior authorizations, just don't think they're going to go anywhere for a while. We certainly, are part of that process to try to minimize those things as often as possible. We do that by, having a network that we're educating our members on, and by constantly expanding that network with friendly physicians and friendly facilities that are willing to come to us, and work to do these things, at a fair and reasonable rate.
Dr. John, is there anything the patient or the consumer can do when they get stuck in this swinging door of prior authorization?
Wow, that's a great, we understand that when somebody's having a medical crisis, it is a medical crisis, and that's a scale of a paper cut to, a cardiac event. I mean,
Right.
If it's you and you're in pain, it's a big deal. And we think it's a big deal, all right? So the first part is, and I know this is so hard because it's such a paradigm breaker because, if you listen to the news and the government, everybody wants to point fingers at everybody, and the insurance company is always the bad guy. The bad guy, they're trying to keep you from getting care, and that may be the case in for some of these major carriers. That certainly may be the case. It's not the case for Ovation Health. We want you to get the best care. But, it's back to one of the sayings I've said in previous episodes. We don't say no, we say not that way. All right? And the reason we say not that way is because we don't want you to engage in services that are expensive, that could potentially bankrupt you, that mean you got care from a provider that's not as high quality as other providers that we have that could give you the same care. So it's almost like you have to say, remember, I understand, take a breath, take a breath, and let us do what we do. There's a reason we're your plan, and there's a reason that you pay us, and that's because we're experts in this portion of the business, so you don't have to be. Unlike so many plans out there, we really do provide a concierge service where we take care of each and every member's medical need and walk them down this scenario. Does that mean you're going to get everything you quote unquote want? Well, sometimes what you want is actually not what you need, right? I think there's a rock song about that, right? You may not get what you want, but you get what you need. All right. So you got to get what you need. All right. And we're that filter that takes away the commercial, the good woman riding a horse down the beach, and like, oh, yeah, but I got rid of that, ugly rash on my arm. Yeah, but you didn't read all the, at the very end of that commercial when they speak really, really, really fast and said, could cause this and this and this and this and this and then death, Well, great, and that's the most coolest, newest thing on the market, but is it really what you need to solve your problem? There's this other, thing that's been on the market for 20 years that doesn't cause all these bad side effects and death. Now, it might take 3 days longer to work, but at least you won't die using it.
Yeah.
All right. So
And
that's
they all
what.
have it.
Yeah. So people have to understand that the medical industry, pharmaceutical industry, hospital industry, even the major insurance carriers, they are, profit driven. There's a reason that they keep remaking and rebranding the same drug to treat the same thing. It's to update patents and to make sure that they can charge a premier markup.
Right.
Right? And it's unfortunate. But again, it's also why we have to have prior authorizations, because we don't want you to do something where you're spending on a pharmaceutical $1,000 when we know that you could get the same pharmaceutical for 10.
Right. That's absolutely great.
Yeah, some kind of biosimilar. And that's it. So that's this episode of the Pulse of Healthcare. We'll see you again in a couple of weeks.
Hope you enjoy it. Thank you.
Thank you.